Welcome back to the Deep Dive. Today we're taking a look at Italian healthcare, which is this really fascinating mix of, well, ultra-modern tech and this deep sense of human connection.
It really is. We dug into a whole stack of sources, and a clear pattern emerged. You see Italy making these aggressive moves into, space-age precision and logistical overhauls.
But at the same time, right?
But at the very same time, they're doubling down on the human element. So our mission today is to pull out the key insights on three big themes: that high-tech precision, the massive systemic changes, and then this vital role of community and, well, longevity.
And we can start with two facts that just perfectly capture this blend. I mean, imagine being guided into the world of the Lord of the Rings as a form of anesthesia.
It sounds like science fiction, but it's happening.
And on the pure tech side, you have this incredible story of a 33-year-old named Andrea, paralyzed for 4 years, who is now walking again, all thanks to Italian neuroengineering.
Let's unpack that tech side first, because the advancements in personalized medicine they're just breathtaking, especially in oncology.
Okay, so the sources pointed to this next-generation radiotherapy, specifically in Verona. What makes this new system, Hypersight and Ethos, I think it was, what makes it such a massive leap?
Right. So the location is the Advanced Radiation Oncology Department in Nigra, Verona, and they're the first in Europe to get this.
The first, okay.
The sophistication is really in how Hypersight and Ethos work together. Ethos is this Italian AI, and you can think of it like a co-pilot that is constantly watching the tumor.
So if it shifts even a tiny bit.
Even a millimeter. If you breathe, if you digest, the AI instantly recalculates and redirects the beam. That's what they mean by true adaptive power.
So it's not just using an old scan. It's adapting live, in the moment. I read the whole thing. Detection to irradiation takes just 6 seconds.
6 seconds. And that speed is what's so critical. It means you get this exceptional precision, but you're also protecting all the healthy tissue around the tumor.
And that lets them treat, what, solid tumors?
Exactly. Prostate, lung, liver, pancreas, and usually in just 5 painless sessions on average. But here's the real game changer. Because the treatment is so incredibly targeted, it allows them to retreat tumor recurrences. I mean, these are patients who previously had no other radiotherapy options left. It's a whole new safety net.
That's a huge improvement. Now let's pivot from that to neurocognitive health, because Italy's also developed an answer for telling the difference between, simple memory loss and actual dementia.
And that raises the crucial issue of timing. You wait until the symptoms are obvious, and it's often way too late for interventions to be effective.
Right.
That's the problem that Traceforia is designed to solve. It's an Italian-made, AI-powered device from a spin-off of the IUS Sula in Pavia.
And what's the time window we're talking about here? How far in advance?
It can predict the diagnosis and progression of dementias, including Alzheimer's, up to 24 months in advance.
So years.
A full 2-year head start. And that gives you a massive opportunity for personalized care. What's also fascinating is that it doesn't just predict the disease. It can tell you which brain areas are most affected.
So whether it's language or memory or...
Exactly. Is it language processing, spatial recognition? That kind of detail is obviously great for the patient, but you can imagine it's gold for pharma companies.
Oh, for clinical trials, of course.
Absolutely. It changes everything. It means they can recruit high-risk patients much, much earlier in the disease progression, so they can test new drugs when they might actually have the best shot at working.
Okay, speaking of logistics, let's talk about the logistics of the human body getting it moving again. Tell us more about Andrea.
Yeah, Andrea. 33 years old, left paraplegic by a spinal cord injury 4 years ago. And this was an all-Italian innovation. You had neurosurgeons from San Raffaele in Milan working with bioengineers from Santa Ana School in Pisa.
And what was the innovation? What did they do to bypass that injury?
It was a spinal neurostimulator. They surgically implant it into the epidural space. And by applying this very specific continuous electrical stimulation plus intensive rehab,
They could restore motor control.
significant motor control. The outcome was Andrea walking 1 kilometer with a walker and braces.
It's incredible. Do the sources say anything about the psychological side of a recovery like that?
They do. And the quote he gave, it just captures the scale of it all. He said, "I didn't remember being this tall."
Wow.
Yeah. It just highlights that immediate visceral return of his entire sense of self. And beyond just walking, he had huge improvements in neuropathic pain and his overall quality of life.
That's such a powerful example of high tech creating a high-impact human result. But that's at the individual level. How do you scale that kind of care across a whole country, especially one with mountains and islands?
And that brings us to our next topic, the systemic overhaul.
Right.
Italy is tackling that exact logistical challenge serving isolated communities by basically turning the sky into a new kind of highway.
So we're talking about drones. Medical drones.
Hmm?
What's the scope here?
The sources point to a few different efforts. There's Project ADOS, which uses this big cargo drone, the FB3. It's electric, can carry up to 100 kilograms.
100 kilos.
Mhm.
So a lot more than just a vial of blood.
Oh, yeah. And then you have Project UELCOM, which uses satellite tech to fly medications into small mountain towns. The key takeaway from all of this is healthcare equity. They're making sure time-critical supplies get where they need to go fast.
And it's more sustainable, too, I'd imagine.
For sure. They're saving on carbon emissions, time, fuel. They even did an experimental flight in Veneto with a green hydrogen drone. So they're not just thinking about efficiency, but about the environmental footprint.
Okay, so drones solve the physical distance.
Mm-hmm.
What about the structural distance between all the different regional health systems? And with an aging population, that's a huge strain,
That points us right to the National Telemedicine Platform, or the PNT.
which just launched in February.
Exactly. It's Italy's big step toward a more sustainable care model. It's a central digital hub that's meant to connect 21 different regional systems for things like video visits and remote monitoring.
21.
Yeah.
That sounds like a
Yeah.
monumental task. What are the big hurdles?
Well, the challenge isn't really the technology itself. It's getting them all to work together. It's interoperability.
I see.
They want to reach over 790,000 patients by 2026. But the real insight is that the hard part isn't building the platform. It's breaking down the cultural and bureaucratic barriers that have existed for decades between these regions.
So aligning workflows, language, all of that.
Everything. So the platform doesn't just become 21 separate silos that happen to be online. And on top of that, it has to meet all these strict new EU regulations like the AI Act and plug into the European health data space.
It sounds like it all hinges on getting everyone to agree to share data.
It does. It requires a huge cultural shift. But that spirit of sharing, of commitment, it's already there in the public. We saw that highlighted on the National Day for Organ and Tissue Donation.
Right, the Transplant Network is considered a national excellence.
It is, and the numbers are striking. In just the first quarter of 2025, they registered over 570,000 new declarations of intent to donate.
And there was that one specific example, a town called Versia.
Versia in Lombardy. It really shines a spotlight on that community spirit. They were named the most generous municipality of 2024. Out of 158 people renewing their IDs, 138 said yes to donation.
And only one said no.
Only one. It just goes to show there's this public understanding that healthcare relies on, well, on collective generosity, not just technology.
Which is the perfect bridge to our third and final segment, the human element and longevity. We've covered the tech and the logistics, but the sources are clear that none of it really works unless the patient feels seen as a person.
And that's the whole philosophy behind an initiative called A Perso Curlala, the Pearls Path.
What is that
It's
exactly?
a recognition system. It's designed to certify the, let's call it the psychosocial customization of treatment. The core idea is that the patient is a unique person, not just a diagnosis.
This is like an effort to standardize empathy. How do you even measure something like that?
It's all based on anonymous patient surveys. They looked at 50 different facilities, and 23 got the certification. But crucially, 20 of those got the highest possible score.
Meaning the patients felt that doctors were really building relationships with them.
Not just listening, but building meaningful human connections. And this isn't just about feeling good. It has real clinical value.
How so?
The research is clear. Patients who get this kind of tailored support adhere better to their treatments. And that leads directly to better clinical outcomes. Human connection is a clinical tool.
Which brings us to maybe the most surprising story of all. Using hypnosis, using fictional worlds as anesthesia. Tell us about the work being done in Piedmont.
Piedmont is a global center of excellence for this. They use clinical hypnosis in surgery, especially for things like treating cardiac arrhythmia. The goal is to induce this unique physiological state where you get deep relaxation, and your perception of time gets distorted.
Right. The patient and the source described their procedure as a beautiful experience. How did they get him to Middle Earth?
It's all about the practitioner guiding the patient. They were first told to imagine being at the movies, and then eventually they were transported into the world of The Lord of the Rings.
And they reported smelling the scents of the fictional places.
So deeply immersed. And think about it. A 4-hour procedure felt fast to the patient. They go back to their rooms right away. The recovery is smoother because their body hasn't gone through the stress of general anesthesia.
It completely redefines bedside manner. Okay, let's wrap up with the biggest secret of all, longevity. The village of Acciaroli.
Acciaroli, yes, in the Salento region. The statistics there are they're wild. It's home to around 300 centenarians, and nearly 20% of them live past 110.
Despite some of them being overweight or even smokers.
Right. They seem to be breaking all the rules, which is why the CIAO project is studying them so closely.
So what are the common factors? What do they share?
Well, the diet is Mediterranean, but with one key ingredient, a very pungent local rosemary. They use it in almost everything, and it's known for its powerful antioxidant properties.
And what about exercise? I assume they're all running marathons.
The exact opposite. The sources are very clear. No structured fitness, no jogging, no gyms. Their physical activity is just a natural part of their day, walking up and down the rugged terrain.
And physiologically, they have very low rates of heart disease and Alzheimer's.
Right, which researchers have linked to low levels of a hormone called adrenomedulin, which is important for microcirculation. But the final piece, and maybe the most critical one, is the social fabric.
The community.
Definitely. It's a low-stress lifestyle. They have these incredibly tight-knit relationships. They're always meeting to chat, have coffee, drink some local wine. That social safety net is probably just as protective as the diet.
So when you put it all together,
Hmm.
what's the big picture? Our sources show this dual focus. On one hand, incredible efficiency with drones and telemedicine. On the other, you have this intense focus on the individual, whether it's through AI-driven oncology or, hypnosis.
That's it. It's precision and community. They're building up systemic efficiency with things like the PNT, but at the same time, using programs like Parello to make sure the focus stays on the person. There's this powerful recognition that no technology can fully replace a human relationship.
Which brings us to our final thought for you, the listener. We've seen in Acciaroli that simple movement and strong social bonds are vital for a long life. So as things like telemedicine and drone logistics free up time for health professionals and reduce pressure on the system, how can we make sure that time is reinvested, not just in more complex technology, but in fostering those meaningful relationships that these sources suggest are just as crucial to our health? What balance will you strike between high-tech efficiency and high-touch humanity in your own life?